Okay, great. Okay. Let me put this in my ear. How you feeling? You got a drink of water? You good?
Yeah, I had
Okay.
a sip.
Okay. So basically, I'm just going to read your bio and then we'll go through
Okay.
some of the questions, okay?
All right.
All right. Hello, everyone, and welcome to another episode of the Heart Next Door podcast. This season, as you know, we are diving deep into maternal health and family wellness, and I'm so excited about the wonderful guest that we have today. I met her at a wonderful Moms and Business networking event. She's so phenomenal. She has a phenomenal story, and I'm so excited for her to share it with you all. Welcome, 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 Latanya Clark Price.
Thank you. Thank you. This is such a pleasure.
Awesome. So I'm just going to take a few minutes to read your bio, and then we'll dive in. Latanya is a native of Detroit with 13 years of a diverse healthcare experience and a reputation for leadership and compassion. She founded E2E following her mother's death from a treatable illness. Her objective is to improve health literacy and the patient experience, especially among underserved populations.
Yes.
Awesome, awesome, awesome. So can you dive in and take us back to, I imagine it was like a traumatic and painful experience that led you here. And I know from my experience too that oftentimes like purpose comes from pain. So can you tell us about your experience and like what led you here?
Yes, absolutely. And that's actually one of my things that I said, turning my purpose into, my pain into purpose. So I lost my mother to heart disease, and it was a treatable condition. However, it was the whole idea of how it happened. Like, she was actually hospitalized 4 months before she was re-hospitalized and passed away. So one of the things that I noticed during her experience and just working in healthcare is that gap of communicating fully to the patient what's going on, and whether that may be a lack of discernment on the healthcare professional or the fact that they don't have time to communicate those needs, or simply sometimes they feel like, well, the patient won't understand to that depth, so we won't dig that deep. But it's very important, regardless of what the health literacy level is of the patient, that you communicate thoroughly. And I know for a fact my mother condition was not communicated to her thoroughly to help her understand, like, this is what you have to do. If you don't do this, you may not live, the rest of this year. Like, that wasn't said to her. Her care was rushed. It was, the quality was poor. It didn't happen. She lived in Ohio. I won't name the hospital for privacy purposes, but there was just several instances where I know that if it was properly communicated to her, she would have taken better action, better care of herself. There was also the instance of insurance. She had insurance, and then she lost her insurance due to her employer didn't offer it anymore because it was expensive for him. He had a private duty health care agency, so she was denied Medicaid because she was slightly over the financial requirement to qualify for it. But then that changed when her client passed away. So it was, just that the whole inconvenience, right, and the fragmentation in the U.S. healthcare system that led my mother where she is not here today, and along with a whole lot of other people that I know that's been in these situations, that's facing these situations now. And I want to make a difference. Like, I want to be that advocate, that person that has, because I have the knowledge, the experience, and it's not reaching where I wanted to. So that's why I said I'm going to start my own organization and reach people to help people.
Yeah, that's so beautiful, and I can definitely Condolences to you for your mom. I can't imagine what a stressful and painful experience that was for you to go through, you know?
Yep.
Especially the piece that you mentioned about the health insurance. That's so relatable to me because that's actually part of my story, my birth story with my daughter. We had moved here very recently, and I had a job, and my employer did not offer health insurance. And so we had to navigate, being pregnant in a world and a nation where it's not very easy for people to be able to navigate the medical care industry if they don't have health insurance. It's almost like you have no options. And thankfully, we were able to find a place that they offer free prenatal care. It's called the Luke Clinic, yes. And now it's actually the only free prenatal clinic in Southeast Michigan, believe it or not. Yeah.
Okay.
And crazy story now, full circle. I came there as a patient, and now I work there. I'm the executive director there, I believe.
Wow.
Yes, so
nice.
I was also thinking that's a great way for us to connect too, because it's so needed for so many women.
Absolutely.
Especially like maternal health is my passion because, in Michigan, the statistics are completely unbelievable and devastating. Just the fact that Black women especially are 4 times more likely to die from, maternal complications. Babies as well are less likely to see their first year of life. So it's so needed, what you do. And so tell me a little bit about the name, that you came up with and the services that you offer, and how are you meeting that need?
Yeah, so E to E actually stands for Educating to Empower Healthcare Solutions. And reason why I went with Educating to Empower, because that's exactly what what I'm about, what E to E is about. It's about educating people on how to navigate the healthcare system, how to, take charge in their healthcare, how to advocate for themselves. And if they can't, I can help with that too. But I feel like that's the first line of defense, is people having the knowledge. And in order for them to get the knowledge, they need to be educated. But it's not just about education. I feel like thorough education, purposeful education, like intentional education. You are telling this patient or this person what they need to know to really help them benefit themselves. You're not just saying it because you want to say something or because it's your job, just to check off a box that I educated the patient. And unfortunately in healthcare, that is a requirement when it comes to documentation. But I know from several people that work, as a clinical staff, nurses, PAs, they check it off, but it's if they just hand the paper with the diagnosis and the description of what's going on, and that's considered education. Well, no, it's not.
Exactly.
It's not thorough education. So at E2E Healthcare Solutions, we offer a numerous type of things. One of the ones that's specifically tailored towards caregivers and patients is my consulting services, where I meet with you one-on-one. Whatever you need to talk about, whether it's navigating your healthcare insurance, understanding maybe a bill that you got, explanation of benefits, if there's a certain type of service that you're unsure if it's covered, I can help you work through that. Understanding your network of providers, how that process works, finding a quality in-network provider, helping you with that. And then if it's something specific to a condition that you may have, I have two members on my team that are registered nurses that can help with chronic disease management. I'm more on the prevention side, so I'm going to educate you on how to prevent illness. So that's where my health and wellness coaching aspect of that type of conversation would go. And then we also offer consulting services for healthcare offices, so service providers, specifically on the patient experience. So how can we improve the patient experience? If you're noticing a turn in your patient retention, what went wrong? I'm there to help, the office understand, analyze, and come up with strategies on how to retain those patients or bring them back, make sure we don't lose continued patients, and just make sure that the patient experience is the way it's supposed to be. It's improved, and the patient feel heard and everything. So and then also we have workshops specific to disease. Actually, one of my team members and I, we had a high blood pressure control. Yes, high blood pressure workshop with a nonprofit organization, and they actually service women that are immigrants or refugees, underserved populations, and free services, or they, if they have like Medicaid, they will bill it, but most of the service they provide is free. They also have other programs too to help women. But yeah, they loved it. Like they was like so happy, and we got much praise and thankful. Like I look at my blood pressure differently. I look at my health differently. This was very helpful and informative. Because we really dug deep. And they appreciated that. So that's another thing that we do too, having those workshops or group presentations to talk about specific conditions, diseases, but how we can prevent them too. That's always included in there. And then some other things that I want to get into as well is patient provider communication. So I do have something that I'm working on, a project with that, where we're talking to actual healthcare professionals, so our doctors, our nurse practitioners, our PAs. How do you communicate with your patient to reach your patient? Are you using health literacy principles? Are you using the tools that you can use to identify your patient health literacy level? Do you even know they exist? Well, that's something that will be revealed in that type of workshop.
Wow. Yep. I love that, especially the piece about the preventative care, because I think that's a big issue. We always seek to treat the disease as opposed to proactively curating our lifestyle in a way where we can prevent and avoid sickness and disease. So I think that's so beautiful and so needed. Yes. And we're just going to take a quick break.
Okay. All right. Oh, she did. Okay. Yeah, you want to be careful. I'll take a sip of water. Thank you. Girl, I didn't know you was, yes, you the executive, yes. Yeah. Oh my goodness. Congratulations. Right. Yes. Is it in Detroit? You did say that. So, yeah. Girl. Oh my gosh. Yes. Yeah. I live in farm, but I'm from Detroit. Yeah. Yep. Yeah. Right. Yeah. That. Yep. And you can be $1, look, 1 cent over the federal poverty line, and they will not give you that Medicaid. They won't give it to you. She is so. She like her daddy, and the boy like you. Yeah. Did you enjoy my singing? Yes. Oh, I know. That's what she was over. Oh, I said that she wants to see what's going on. Yeah. You can face her towards us so she can see us. Yeah, and that's the thing. Like with me, in addition to, said I want to see what's going on. You got something on the phone? Is that a cartoon for her? Oh, okay. Oh, okay. Right. Say, that lady. I see that lady over there. Yeah, my husband want more. It's just, whew, we don't have a support system. Like, it's just me and him. Like, my mom, his parents is in Jamaica. My dad is in Jamaica. He got deported. Yeah. My mom's American, but yeah, I'm half Jamaican. Yeah. yeah. So, I mean, he has an uncle here, but he got his own life and everything. So we don't. That's the only. I'm just concerned of not being able to. I don't know, mentally. And he works midnights. Like if his things, which he's working on his schedule and stuff. Hopefully, I think that would change once he's more home during the day, and then my daughter starts school full time and all that. Like, yeah, it'll get easier.
No, I don't blame you. That's good that you're thinking like that. Like we moved here from Texas when my son was not even 1 yet.
Oh,
and
yeah, it's hard.
It's so hard. It's hard. It's really, really hard.
Yeah.
Because we don't have no family here, you know? It's a big thing that you don't think about.
Yeah.
I'm happy you're thinking about it.
Girl, yes. I'm like, look, I gotta know what I can chew.
Yes.
Look, don't bite off what I can chew.
Exactly. So we can, for the sake of time, tell me if there's anything in specific that you want to dive into. I was going to ask you about, like your advice for, like when it comes to like maternal perspective, like for moms navigating healthcare.
Yeah.
Misconceptions. How can we better advocate for ourselves?
Yeah. I can touch on that stuff.
Okay. And then maybe I'm gonna ask you a little bit about your background too. You said health.
Okay. Yeah. Yep.
All right, we are back. Well, that is so awesome. I'm so excited and thankful, for the need that you're meeting through your services. And you mentioned too, that you have a background in healthcare. So can you talk to us a little bit about that? Like, what were you doing before you dove into this?
Right. So I've been working in healthcare, like I said, 13 years. So many different disciplines. My very first healthcare job was in mental health. I worked at a group home with mentally ill women. Did that for 3 years. From there, I worked as a medical receptionist at an eye doctor's office for a few years. Started school, got my associate's degree in business facility management, and then I enrolled for my undergrad. So I have a degree in health administration, and just been trying to work my way up the ladder. That hasn't been successful for me. I've always been a stellar employee, and that's not me just tooting my horn because I really take my job serious when it comes to patients. Anything to do with patients, I believe in going above and beyond in excellence. So yeah, and then I kind of switched to pursue nursing. I was encouraged to pursue nursing because my career track wasn't moving that fast with health administration. So I did start nursing school. That's a long story, but I ended up not continuing with it. But I worked as a CNA in the nursing homes. I did home health care. I worked in a jail before. Yep.
How was that?
I know everybody always so blown away by that. You know what? It was actually pretty interesting. Like, I enjoyed it. I did. It was a different population of people, but they really appreciated the clinical staff. They did. And I was always there advocating for them if they need something. Like, I was the medical assistant / CNA. So, I went around, do rounds for those who have high blood pressure, check their blood pressure. Some of the ones that were diabetic come down to get their sugar checks, give them insulin, because they couldn't have sharps, right? So we had them come down to the clinic. If there was a complaint, anything, like I advocated for them, and I had a lot of respect. So they loved me. They did. So that was interesting, and I actually resigned from there to start nursing school because I got called a year early to get into to start the nursing program because I was on the waiting list. But yeah, and then from there I worked at a federally qualified healthcare clinic. So that's FQHC, and they're funded by the government to provide low to no cost healthcare for people that are uninsured or underinsured.
Was that in Detroit?
Pontiac.
Oh, Pontiac.
Yep.
Okay.
Pontiac. So we had a lot of Latino patients, and that was very rewarding as well. And my responsibility was dealing with referrals and authorizations and coordination of care, making sure they, if the doctor referred them to specialists, that those needs are met, and any other needs that they may have, like transportation, barriers, things like that. And then I actually, and I won't name my employer now, but I am currently employed by a health plan, insurance in the Medicaid health plan. So, yep, and that's more towards population health.
Yeah.
So, all my experience combined, wrapped in one, it allows me to deliver on what what E2E is about. On top of passion, right? That passion is what drives me. The knowledge is great, education is good, but you have to have a heart.
Definitely.
You have to. Otherwise, you're doing it for nothing.
Definitely. I completely agree with that. 100%. And I know that you are a mom.
Yes.
Of a 3-year-old little girl, right?
Yes.
Awesome. My son is 3 years old too, so I love that age. That's a fun age.
It is. Oh my gosh, very fun. And girls is very interesting.
Oh, I'm starting to see with this one. Yes, they're so different. Yeah, well, what a blessing. So I'm curious to know from your perspective, like as a mom, and also thinking about the services that you provide, what are some tips or advice that you would give for moms who are, maybe pregnant or expecting, or even just navigating like that, the whole insurance space, that world we talked about? What are some tips that you would offer for women to be able to advocate for themselves and their family?
So health insurance, so important. And it's almost like you're limited when you don't have health insurance. But there are so many programs. Don't get discouraged if you are at a certain income or you feel like I'm not going to qualify for Medicaid because I make too much money. You still apply. There are so many different programs, like the state of Medicaid. They have moms. So this is specifically for prenatal care, postnatal care, helping to deliver the baby, and then it falls off. And I think there is a higher percentage above the federal poverty line that you have to meet. So it's set higher so people with higher income can qualify or whatever. Obviously, there is organizations that can assist with prenatal care, postnatal care, the vitamins, so lean on your community organizations that may be tailored towards providing resources for healthcare. If they don't do it themselves, they likely are able to refer you to somewhere else. Even me, E2E, like I know where to look, so even just calling me and asking me, I can help with that. I would also say the hospitals, they have programs as well, financial programs as well, when it comes to delivery, where you can either get it written off or go on a payment plan. But I'm talking about the cost aspect because I know that's a thing that gets in the way. It's a barrier to healthcare. People don't seek healthcare because they're concerned about the cost. They can't afford it. But it's very important. Prenatal care is very important, especially when it comes to the mother's health, the baby's, development. It's so important to get those checks and lean in on your community to help you with, guiding you with that. And then when we're talking about the actual engaging in the healthcare system, right? So now going to your appointments. I know now, like Detroit, they have where they provide transportation to moms so they can get to free transportation to get to their appointments. And if you are on Medicaid and it's a managed care plan, 9 times out of 10 they provide non-emergency medical transportation at no cost to you. And a lot of people don't know that, but they do. And then there is programs that offer. So don't be afraid to ask for help. I know that's a thing, you know, I struggle with it too. But when you're thinking about that baby,
for sure.
you want to ask for help, because it's not just about you, your pride. It's about the baby you're carrying, making sure that baby is healthy and delivered safely. So ask for help. It's nothing wrong. It's help out there. It may not be broadcasted a lot, but it's out there. And if you ask the right people, you know, you'll find the answers. And I'll also add, when it comes to the delivery process, like, you know, obviously you want to pick a doctor that truly listens to you, understands you. If whenever you feel like something ain't right, you switch that provider. Don't feel obligated to stick with a provider if they're not treating you well, or it's just your gut is rubbing you the wrong way.
Say that again.
If you want to have a vaginal delivery versus a C-section, like, I know for me, my doctor, he, at the time, he was my OB, and he was like, well, I'm going to tell you, I have a high C-section rate. That's what he do. And he like, so you may want to, you know, switch.
Wow.
Yep, I do, because that's not my preference. If I have to, I will, but that wasn't my preference. I wanted a vaginal delivery. So, you know, creating a birthing plan. A lot of people don't know about birthing plans, but it's a valid document. It is something that you want to fill out to have ready, put it in your bag, like pack when you're getting close to delivery. Pack your little bag, have it by the door, make sure that's in there, so if there's any emergency, they have that they can reference. I had used the app, I can't remember, I can't remember the name of it. Oh my gosh. It was an app. I think it's like Baby.
It was like a prenatal app. It was like the baby. I know what you're talking about, because I used one app too, where it shows your development of your baby over time.
Yes.
I think it was called Baby or Pregnancy or something like that.
Yeah. But that app, they had a template that for the birthing plan, you know, and you can Google birthing plan, you know, templates. But I really encourage you to fill that out. Make sure that, because that way you have it in writing, your preferences, and you show that to the doctor, to the nurse, you know, so they can honor those. At least you try to make sure that they honor those things. Some things obviously can't be honored depending on what's going on, but you try to push, you know, for your preferences. And I'll leave it at that. But the main thing is, you know, making sure that you have support, family there, second, third eyes, to be there, and don't be afraid to speak up. Another thing that I want to mention, and this is really across the board. I know, regardless of what health situation you're giving a baby or going to the doctor or at the hospital for an emergency, but understanding that the healthcare professionals are humans too, and it's, you know, typically when we're sick, we're not in the best mood. It's a heightened situation. But if you want the best out of your care experience as the patient, you also want to be mindful of your attitude as well.
Oh, that's true.
You don't want to go in there fussing, screaming, cursing out the doctors. You will not receive. They won't receive you well. You won't get the care that you need. And I know we feel like, you know, that it's their duty, that's what they're supposed to do, it's their job. But when you think about it, they're still. So how would you receive someone that's yelling and screaming at you? You wouldn't, you know, you'd be like, no, I'm not doing that for you, or I'm gonna do it, but it's not, the quality isn't going to be there. So I know that's not really talked about much.
Not at all. I've never heard anybody say that, but that is so true.
It is.
So true.
Yep.
That's so true.
You know, and I'm not saying kiss their butt or anything, but you just want to be level-headed, because at the end of the day, these people, your life is in these people's hands. It's just like when you're going to get food. You be like, I want to tell this driver, the food driver, you know, in the food line, whatever, but you know what, I don't want them spitting my food. So you're like, I'm going to chill out.
No, that's a great analogy.
It's the same concept when it comes to engaging the healthcare system with healthcare providers. Yeah, you may be upset, rightfully so, but just chill out. Just, and things will work out better that way. It will. Because then you won't give them a reason to say, that you were nasty and disrespectful. Like, you don't never want to give them a reason to justify their behavior.
For sure.
That's something to think about. And I know, it could be hard because those are stressful situations, but just try. That's what I say, just try.
Yeah. Wow, I love that. I love that. That's so true. I've never heard anybody say that, but that's like a very honest, perspective. And I think we need to be told that, honestly, right? Like, of course, we can have expectations of our providers, but we also need to check ourselves and have expectations of ourselves too, right? Because what you give is what you receive oftentimes.
Yep.
Yeah, the energy you give is what you receive. So that I love that you mentioned that. So as we wrap up with a couple of other questions, I'm curious, you talk about health literacy in your mission. Can you explain for people who don't know, what is health literacy? What are some misconceptions about that, and how do you address that?
Right. So health literacy is a person's ability to find, read, understand, and apply health-related information for themselves, their family, if they're a caregiver, to help them as well. So when we think about the whole idea of finding, so that's researching, navigating the internet, navigating maybe the healthcare organization to find the information that people need to use for their healthcare. So whether that's finding a doctor or finding a health plan, like finding health-related information, and then understanding that health information. So when an organization is considering health literacy, like, they are making sure that the information is digestible for people that are at a lower, reading level. Like, I can't remember what it is now. I know at one point I feel like the average American was like 3rd or 4th grade reading level. It may be higher now, but just considering that. And I think with health literacy, you even want to, I think it's a 2nd grade reading or 3rd grade reading level, that you want to make sure the information is. So that's one aspect, and then applying it. So now it's like, I found it, I understand it, and then I'm able to apply it. But if you don't understand it, if you can't find it, you can't apply it. So that's what E2E is about when it comes to health literacy, is from navigating the healthcare system, from health insurance up to receiving care, so engaging in services, how to navigate that process, discharge, how to navigate that process, how to take care of yourself, and even rolling back, how can I even prevent certain things so I don't have to, be going in and out of the hospital, in and out of a doctor's office. So that's what health literacy is about. And I think when we're talking about the communication aspect, because I feel like a lot of organizations, they are doing better when it comes to like the written materials, but there's still some communication barriers when we're talking about the doctors. So that's why I feel like doctors need to be better educated on health literacy principles and using that when communicating with their patients, because they talk with doctors, high executives, throughout the day. So sometimes it can be hard for them to make that switch. But maybe if there's some type of reminder, that could help. That could help them, change the way they address their patients. And then just making sure that they understand. I know, and that's, what E2E is about. Like, unfortunately, the climate that we're in with healthcare, it's hard, and people, the healthcare professionals, they don't have the time to sit there to thoroughly understand, make sure you understand that information. So that's why a goal for E2E is to partner with healthcare organizations to fill that gap, so they can say, hey, do you mind reaching out to Mrs. Smith? I'm not sure if she truly understands, but could you reach out to her just to follow up, making sure she understands her care instructions, her medications, things like that, which is another aspect of health literacy too, is numeracy. So a lot of people, they don't understand the dosing of their medications. So there's problems with that, when people misdose taking medications and complications happen as far as fatalities, you know, if you take a medication. So that's another part. And they've gotten better with trying to simplify that. But to me, it's nothing like that one-on-one. Just me and you in front of you watching my lips move. I'm showing you, you know, it's different. It's just different. So that's what we're about at E2E, to make more impactful. Obviously, you know, now we're in the digital age, so we got Zoom and, you know, other methods of communicating with people. But that one-on-one time is important. So, like I said, just connecting with healthcare organizations and partners on helping, you know, patients, because they don't have that time to deliver that information.
Yeah, that's so true. Wow, this is amazing. Everything that you're offering is so amazing, and I'm just thinking about, you know, my own experiences, just from like maternal perspective, like having 2 kids, like what added value that would have had to my experience that I had, you know, someone like you from E2E in my ecosystem of care and like in my care network, because there's so many things we don't know how to navigate, you know, we just we all need that support. So as we wrap, I just want to know, what are you excited about for E2E, and, you know, where can people connect with you and learn more about what you're offering?
Yes, so I'm really excited about really making a connection in the community and being able to help more people on a community perspective. That's kind of what I'm pushing right now, is to build that connection with people one-on-one, and just really helping people see the value it is when you have that support in an advocate, a healthcare advocate. And obviously, you know, connecting with healthcare organizations, I feel like that will allow us to have a wider reach, you know, for people. And, you know, I'm new, so a lot of people don't know who I am. So sometimes, you know, connecting with a healthcare organization and learning about me through that way would be helpful for people to trust, you know. And that's what we want to do. We want to build trust with, you know, bridge that gap of trust that's in the healthcare system between the healthcare organizations, and be that support. So if you want to find me, I'm on Instagram, and my Instagram handle is e2e.healthcare.solutions. I'm also on Facebook, and it's just the name E2E, so E, capital E, number 2, capital E, Healthcare Solutions. I'm also on LinkedIn, and you can find me that way as well. And I'm an open book, so I have, you know, if DM me if you have a question, you know, I will be happy to answer in any way possible to support you.
Awesome. Well, thank you so much. Well, clearly you have, you know, just a wealth of knowledge and wisdom, and I know that anyone who reaches out to you is going to, you know, definitely be a lot better off in your healthcare experience.
Absolutely.
So I'm so thankful that we met, and I know that we're going to do some partnerships for sure. And more to come. So thank you again for coming. We'll see you guys next time on the Heart Next Door. Bye.
Bye.
Yeah, no. She's like, look, she's like,